This meeting is being recorded.
And
Hello,
we are
everybody,
live.
and welcome. Welcome to the second episode of All You Need to Know, the questions that keep you up at night. And tonight's episode, or today's episode, we are so thrilled, Pam and I, to be speaking with Candace Smith. And for those of you who did not see the first show, I should probably back up and explain that this is a collaborative show. It's very relaxed and informative. It is really, I am the moderator, Madeline Francesi from Hebrew Senior Care, and I am fortunate to be doing this show with Pamela Atwood, who is the principal owner of Dementia. Oh boy, am I going to mess up your business? Atwood Dementia Counseling, right?
Okay, so that was a cognitive test. Atwood Dementia Group.
And counseling. You don't have the counseling in there?
I
No.
do know it's coaching, consulting, and counseling.
There you go. Coaching, consulting, and counseling. And enough to say that Pam Atwood is made a career and a lifetime of helping people and families dealing with this horrible illness of cognitive impairment. And I use that broad term because, as you will learn as we go through shows together, that there are many different types of cognitive impairment. And a lot of us just use the word Alzheimer's, but not all of us have Alzheimer's. So Pam is really an expert on counseling, not only the people going through it, but the caregivers, and also training professionals like our staff at Hebrew Senior Care, how to offer the most effective programs and how to deal with any issues that arise. And with that, I know Pam has a good and close relationship with Candace Smith, and we are thrilled today to kick off our show with Candace. And Candace is the executive director of Hebrew Senior Care's Adult Day Center. And we are thrilled to be able to talk to Candace about this important, critical, vital program that has sort of gone into a little bit of a cocoon during COVID. But now people are calling and looking for these community-based services, and we're going to tell you why and how. And with that, I think I'd like to turn it back to Pam to start.
Thanks, Mad. Yes, so this is one of those services that I think when families ask me, what do I need to put in place in order to avoid nursing home, in order to keep my family member home, because that's where she always wanted to be. I think that this is one of the most vital services because it helps prevent that caregiver burnout. And we talked a little bit about that in our first show. And I think that unfortunately, at least here in Connecticut, and I know many other places across the country, adult day programs are far and few between because there's just not enough funding to pay for it. And a lot of times, and we'll talk a little bit about the fees and the costs in a little bit, but this truly is, I believe, one of the most vital programs in order to provide options so that it's not just assisted living versus nursing home. You know, what are some of the other options? And it's not for everybody. We'll talk about that as well. So I'm really excited to introduce you to Candace. And Candace Smith is, as Madeline said, the executive director of the day program at Hebrew Senior Care. And she and I have been working on a couple of different projects within the day program. And we wanted to fast track this because I just had a client ask me about day program and say, well, what are the options and what do I, and is this really yada, yada, yada. So all of my questions come from families today. But I wanted to start with Candace, let's talk about what are the qualifications, because I know a lot of times we just think, oh, I'm taking care of mom. Why don't we have this neighbor or that friend come over and we'll all just take care of each other together. But a day program is quite different and it's structured and it's actually licensed, right? Tell us a little bit about what goes into the kind of background structure of a day program.
So most of the adult day programs in Connecticut are required to be accredited by Connecticut Associations of Adult Day Services. That accreditation lasts for about 2 years. We do require that we have a registered nurse. You could also have an LPN with a registered nurse in the building. There also has to be a dietitian on site. There also has to be program assistants, and as well as a therapeutic director. So there are definitely, it's not just something that you can just say, oh, I'll just send my relative to any day center adult program. They have to have qualifications.
Sure. Okay, great. And I think there are different models, right? There's a social model versus a medical model.
We are a medical model. There is a social model available. A lot of funding will not pay for a social model. They only really pay for medical model. But you know, if
And
you have
what's
a
the difference?
So social model is just somebody who they don't have any cognitive.
Oh, I think we have a connection issue.
Home alone. You guys see me? Hear me?
Yeah,
there's a
you're
little-
cutting out a little bit. You were just
Okay.
saying what was the difference with social model?
Okay, so social model is basically somebody who, you know, they're isolated at home, but they have nothing else is wrong. They just cannot be left at home alone, or they want to get out the house and socialize with their peers. So that would be a social model. A medical model is more of, they need more a hands-on help with medication administration, with ADLs, eating, you know, dressing, you know, we do give showers as well, things like that. So this medical is more extensive.
Okay, thank you for that.
Can I question then? What's the difference then between a social model and a senior center?
Very, very, very similar, actually. They're actually the same. A social model day center and a senior center are quite the same.
So
But
really the only differences may be that the social model provides a lunch.
senior centers provide lunch as well, but they're not accredited by the Connecticut Association of
Adult day centers.
Right. And then, like the senior centers, it's more of a, I don't want to say volunteer. Yeah, people go have fun with their peers. There's different arts and activities, the same thing as social model, but like
It's maybe not a per day rate.
right, and you have to apply to come to a social model day center.
Okay.
Seniors, I think you just walk in. Anybody can just walk in and say, "I'm going to be here for the day." I sign in, and I'll do the different programs. But you have to actually apply. You have to be appropriate for the social model day center.
Okay. Perfect.
So tell me also,
I'm sorry, social model day centers also don't have a nurse.
there's excellent point. Excellent differentiator. Yeah. And that is important, I think, especially for the population of people who have cognitive disorders, because we know that, I mean, the only thing we really do know about cognitive impairments like Alzheimer's and vascular and Lewy body dementia is that they're progressive. And a nurse can specifically monitor for those changes. And also, especially if there are behavioral issues, you know, they can test for, you know, listen to the lungs or dip the urine, you know, they can kind of help along with those paths to help the families have some medical insight rather than, oh, do we have to call the doctor again? You know, those kinds of questions. It gives them a medical touch point so that they can have some oversight more regularly. So that is an important differentiator for this population. Tell me, Candace, who's the perfect candidate? When you look at older adults with cognitive impairments, when is the right time? Who is the perfect candidate for adult day program?
I think the perfect candidate would be a senior who is staying at home all the time. There's no engagement. They're having, you know, difficulty adjusting. You might see that they're getting frustrated. They need extra help, but you know, you just don't have the funds to have like an at-home person 8 hours a day, 5 days a week.
Okay. How about, you said senior, what about someone with young onset dementia?
Young onset dementia, absolutely. I think our youngest client was about 60 years of age. That was our youngest. I've never seen anybody in my experience, and I'm pretty sure they're out there, join a day center that was under 60 years old.
So it maybe varies center to center.
Correct.
Okay.
But I mean, I think that loneliness, isolation are big factors here, as well as, respite for the caregiver. A lot of these people who are joining now, they're desperate, they're burnt out,
Yeah.
and they've taken their frustrations out on a loved one, and it's really not their fault, it's the disease.
Right.
So, we want to help you alleviate that stress. So it's good to just like get them out of the house, and they're gonna have a ball. They're gonna have
Exactly.
fun.
Candace, how many people, caregivers, have difficulty first adjusting more than their loved one? They feel guilty. So do you agree that a lot of times, not that it's not difficult for the person who needs services, but the caregiver feels like that's not what I should be doing with my mom, my dad, or my spouse? Talk about that guilt.
In the beginning, in my interviews, they all have some guilt.
So everyone interviews before they come to Day Center?
Correct. They all interview before they come to Day Center. Just make sure that the client is appropriate for the Day Center. But the guilt is in the beginning. And then after the client gets used to the program, they really see how it benefits the client as well as their self. And all that guilt just goes away. But I always say, you have to give it a chance. Give it a chance. If you want to start off slow, a few hours, I don't recommend once a week. I recommend like at least twice a week to get them used to it. Couple hours. We actually have a client, her husband has extreme separation anxiety from her. He's very worried that, she won't like it. She won't gain, get the full benefit of the Day Center. He was initially 3 days a week. He saw how wonderful it was going, so he increased her to 5 days a week.
Beautiful.
I always say, give it a chance. She'll get used to it. You'll get used to it. You'll enjoy some of the freedom that you have. When she's coming here, you don't have to worry. She's in our hands.
Exactly.
That's probably the biggest question that families ask me is, I don't think she's going to like it. I don't think she'll agree to go. What's some of the magic that you guys do that keeps people from saying, I'm out of here, I'm not staying, I'm taking off?
So I like to be professional, but I also like to have a family environment. Open door policy. They can come talk to me anytime they want to. If I notice that a client is having a difficult time, I often do one-to-one with them, bring them in, depending on what their cognitive level is, have a discussion, what's going on today, just make them feel like they're part of a family, that they enjoy coming here. So it'll be a positive experience. When they see me and I'm smiling from ear to ear and they just see, I'm like, oh, that's Candace. It's one client, doesn't know anybody in here, but she knows she's Candace and she treats me great.
Yeah.
So I just like to have like a family environment. You treat them with dignity. Make sure they're having a good time. I make sure they're doing something all the time. So keep them busy, just fun activities.
What's a typical day? Tell me what a typical day would be like in the Day Center.
We have early, I call them my early crew. They come in about 8 o'clock. So we have coffee. We'll have like continental breakfast. They'll watch the news. And then we prepare for the other clients. So they're all arriving between 8 a.m. and 10 a.m. And then we'll start off 10:15 is our current event. We'll talk about what's going on in the world. Of course, everybody knows Queen Elizabeth died. So that's a big discussion. It still is, which is fine. These particular clients like to talk about things that they've seen on the news. Some of them are gory, but I try to tell them to keep it PG. We talk about, things that's going on in the world, or, sometimes they like to talk about things when they were younger. And we'll talk about things like that. Then we'll start our program about 10:30. So in the morning, I like to do something more cognitively stimulating. just not to tire them out too early. So we'll do like a trivia, or they love bingo. We'll do some color matching. Being that our clients are lower functioning, we do a lot of like color matching, a lot of matching, a lot of little hands-on things to stimulate them cognitively. Then of course we have exercise every day, 11:30. Then 12 o'clock, we'll have a beautiful lunch, 2 choices, kosher, of course. And then 1 o'clock, we'll start the second half of our program, which is going to be a reactionary exercise like a kickball or bowling. We'll do like balloon toss, and they really enjoy stuff like that. So, and I noticed that those active activities really prevent behaviors, because they're involved in the activity that, you know, they don't have time to be wandering around or, you know, trying to get out the door or anything like that. They're really involved in the activity.
Excellent. Great. Now, do you guys, you mentioned your meals are kosher.
Yeah.
I know the answer to this, but just to clarify for everybody else, do you have to be Jewish to go there?
No. We only really have 2 Jewish clients. We have many different faiths. Our newest guy is Muslim. So, you know, it's just one big melting pot.
Wonderful.
Which really does bring us back to, because cognitive impairment doesn't just impact one person or one group of people, it's affecting all people. And it really is affecting everyone as we age, and as we live longer, we're seeing more of it. And so day center services are critical components, Pam, as you stated. It's the connective tissue between needing maybe more in-house care or inpatient care in a nursing home to someone who could really still be in the community that they live in, but they need some help during the day so that either their loved one or their children could go to work, peace of mind, knowing that that person is A, safe, B, getting some kind of socialization. I think the statistic is that loneliness and socialization deprivation for seniors equals 13 cigarettes a day.
Yep,
So
takes
when
8
people
years off your
say,
life.
yeah,
Wow.
when people say it's really not, you know, yeah, they're lonely, but that's, you know, it'll be okay. Maybe not. Loneliness matters for everybody. And I think COVID showed that, right? We're a social group.
Absolutely.
We need each other.
Madeline,
So
I'm sorry, Madeline,
no,
go ahead.
no, I was going to say, so Candace, are people scared to come back because of COVID? And if they are, what can you say to reassure them? Besides the fact that no one got COVID at the day center, besides the fact that we've kept everybody safe, how can we reassure families that this is the right thing to do?
Well, I think that now, as time has progressed away from this pandemic, I think that it's less about COVID and it's more about how is my loved one gonna feel? Like you were saying before, the guilt. It's oh, you know, I don't know if they like it. What if, you know, they don't, what if they tell me no? You know, what if you know, they're giving me an issue? What if they're fighting with me? And like Pam was saying earlier, you know, it is not right for everybody, the day's environment. But I in my interviews now, it's more about how am I gonna get dad, mom, wife, husband here? And sometimes you gotta tell them little white, if you really want, little white lie is not gonna kill anybody. You know, listen, you're going to a senior center, you're gonna have fun, or you're gonna have lunch with your friends. Once they get here, they'll be fine.
I do have a client who loves to volunteer, and you know, his wife was saying, well, could he go volunteer there?
Correct.
And he's a music person. So we had said, yeah, he can do a music appreciation program or something. And it starts with 1 hour and lunch and evolves into a relationship where he wants to go every day.
Right. Right.
And
Feel
what
useful.
name should they call it? I mean, do they have to call it the adult daycare? I mean, to me, that just always rubs me the wrong way.
I always say, just tell them they're going to the senior center and they're going to be having a ball. But to the volunteer, we did have a client who did come here and volunteer. And, as her Alzheimer's progressed, she ended up having to do 5 days a week, of course, 8 hours. 8 hours. She does 8 to 4. So that was a really a good transition for her because she was volunteering. So, things like, okay, you're going to come here and volunteer, and I'll say, you can help pass out the bingo chips, and you're going to help this person play bingo, or you're going to help this person answer the trivia questions. You're going to help this person paint their project. Just, involving them more in the daily activities.
I like that.
Yeah.
I'm sorry, Madeline, did you have another question? I don't.
Let's see here. I know a lot of day
Sorry.
centers.
Somehow my ALEXA thinks I asked her.
During COVID, a lot of day centers in the state of Connecticut closed, certainly.
Right. Active Day was I think they had a chain of 3 day centers and they're all closed. Yeah.
So, the fact that you're open means you succeeded in doing something right because, to your credit, you stayed open, you stayed safe, and you stayed available for anybody who needed those services, even during the pandemic. Talk about trial stays. So if someone wants to do this, but they're a little nervous, we can do a trial, right?
Yes, you can absolutely do a trial day, see how it goes. We do, unfortunately, not want anybody who's violent. So that would be our only obstacle to admitting somebody to the program. But, just a trial day, see how it goes. 9 times out of 10, it's going to go fine. Once everybody gets here, they start talking, they meet the Golden Girls.
Yeah. And who are those Golden Girls there?
Those are the two clients who have to sit next to each other every day.
That's funny. The Golden
great.
Girls, I love it.
One of the things I was going to ask you, Candace, is if a family member is looking at different day programs, what are some of the questions they should ask you to interview you or other day programs?
I would definitely ask them about their staff to client ratio.
What should it be?
It should be no more than 7 clients to a staff member.
Okay.
So, a lot of day centers, I want to speak positively about them, but a lot of day centers have a habit of, you admit 40 clients to the program. However, you only have 3 staff members. You're not going to have it's not going to be good quality person-centered care because you're not going to be able to focus on individual clients. It'll be more about
You're gonna have parked people.
Right. So you really want to join a day center that is very patient-centered care or person-centered care, where we focus on the needs of the individual.
How do you demonstrate that? What would families look for to say, they're doing person-centered care?
So let's say I had 2 different clients. One client, I'm trying to get a good example here. One client, very bad short-term memory. The other client, no cognitive dysfunction at all, but likes to talk. Just spending time with those clients individually, not forgetting this person who is low functioning still would like to be social as well, and include that person in the conversation. That's just a broad example.
So kind of drawing them out and knowing their story, knowing who they are as people. One of the things I think for Madeline and I, it would be
Mhm.
very easy to envision our lives going to an adult day program because we're very social people.
Mhm.
And we would be your golden girls who,
Right.
by
Yeah,
the
get out
way,
of my chair. That's mine.
just so you, right. Just so you know, last week I learned that Rue McClanahan was 51 when she started on the program Golden Girls,
Oh,
which means
great.
she was younger than me.
Yeah, right,
I'm not
exactly.
happy about that. I'm over it. Okay. So,
Yeah.
but let's talk about, some people have always had, they were the Valium generation or whatever, right? They always had a little bit of social anxiety. Are they
Mhm.
appropriate for adult day, or should we just say, no, 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 it's not okay for them because it's too social and they won't be comfortable?
Well, we have a math teacher who has his PhD, who wants to do his own thing, does not want to be bothered by anybody. So he has his puzzles, he has his crosswords, he sits and he does his crosswords. Every now and again, he will join a program, but he likes to do his own thing, and that is also okay.
All right.
Mm.
So you can
Well, that's
adapt to meet people's needs.
Yes.
right.
Wonderful.
That is good to hear because some
Mhm.
people don't want to be forced into a
Right.
table of people and told they have to socialize. And then
Right.
we think that's going to create calm for someone who is
Right.
never comfortable doing that.
Exactly.
And just because you have cognitive impairment, you're still the person you were.
Mhm.
And I think that's another thing to look for when looking at a day program. I know you are like this, Candace, and certainly Val, your nurse, and Jennifer, program people.
Mhm.
Know the person before even the cognitive impairment. Who were they? What are they about? And to Pam's point, so you're not ending up in a center where you're just being parked in a
Right.
chair and you're just
Mhm.
another old person who needs to be attended to. Um,
Correct.
and I think that goes back, correct me if I'm wrong, Candace, I think Hebrew Senior Care opened one of the first day centers in the state in 1973.
Yeah.
So our commitment as a senior care provider agency
Mhm.
has always been to these comprehensive services, especially those that keep seniors home and well attended in the community.
Mhm.
And that's a commitment we've made now 50 years ago. And so I'm very proud of this program that we offer. And really, I know we have transportation, but for just a minute, talk about the costs. Obviously, nothing is free, unfortunately, and
Right. Right.
day center is not covered, unfortunately, by Medicare. So that might be something, if you're listening to this program, you should call your legislators and maybe talk
Absolutely.
about the fact that if we want to do more community-based services, we need to have the money follow the person. And so Medicare needs to start to think about that. But talk about what it costs and what are the options for help.
So we charge for, let's start with a half day. You only want to come for a few hours. That's going to be $59.50. That's anything under 4 hours. Anything 4 hours or over is $79. That's without transportation. That's if you're transporting on your own. That's a lot of our outer towners, East Granby, Avon. Those are self-transport. We do transport, and it's going to be $85 for a full day. We do offer things like showers at an extra fee. I think showers are $8. You can get your hair cut. That's $8. Get a shave for a couple bucks. And of course, the meals are included and the fun is included.
Fun is an extra, huh?
Yes.
Meals
That's
and
great.
fun included. That's great.
So we've got $8 for showers, $8 for haircut.
Mhm.
What is that? $6 for transportation and $70 for fun.
Yeah.
Exactly.
Don't
But
believe that. Don't tell that math PhD because I'm terrible at math. I probably just totally messed that up.
now there are available fund options through NCAAA, right? NCCCI.
NCCCI.
Well,
All
let's just clarify for our viewers, AAA is not the automobile club.
No,
Right.
NCAA is North Central Area on Aging. CCCI, that's I believe is Medicaid funded through the state, as well as another, Alzheimer's Association also gives grants to clients for day center services.
Excellent. So there are some resources out there. If people want more information, how can they get a hold of you, Candace?
Yes.
They can email me at csmith. What is it? csmith.
At Hebrew.
Okay, I'm sorry. I don't know.
You don't email yourself?
I never do. csmith at hebrewseniorcare.org, or you can call me on my direct line here, 860-523-3857, and I'll be delighted to speak with you. And really, we're here to support you. Any questions that you have, I can answer it. Valerie's wonderful. She's my staff nurse. She's awesome. I'm a certified dementia practitioner. I've been working on the floor, a lock unit, Alzheimer's care unit for 10 years. And this is what I'm here for. I developed a passion for it. It's what I love.
Awesome. So lucky to have you on board, Candace. Absolutely a great community resource. Thank you for your time.
Absolutely. And
Thank
people
you.
listening to this, think about the holidays. That would be a perfect time to get some peace for yourself. You know, maybe you start in October and then you can go all the way through November, December, and be able to go home and say, you know what, I can cook for Thanksgiving without stress. I actually can get some shopping done because your loved one is going to be with Candace making you a gift for the holidays.
That's right.
Having fun.
Exactly. Having fun.
And working out that brain.
Yeah.
Exactly.
Yeah.
This has been a great show and filled with a lot of important information. Again, I can't urge people enough. Please call Candace, reach out. If you're caring for someone at home with a cognitive impairment, or just someone who doesn't have a cognitive impairment but is home alone, isolated, give Candace a call at Hebrew Senior Care. It's really, we've been doing senior care for 121 years. It's not just something we dabble in, it's our passion. And so, as Candace has said the word family a number of times, as she's described her program, it really is a family. And no better place do I love to go than sit in that day center and talk to the clients. They have a wealth of information and they've accomplished so much in their lives. And the idea that we can give back to them during this time is very gratifying. So,
Absolutely.
Thank you, Candace, for joining us.
Thank you.
Thank you again for all you viewers out there in the web world. Just to reiterate, and we'll put it in the comments below, Candace's number, her direct number, 860-523-3857. Did I remember that correctly?
Yeah, that's awesome.
Cognitive test for me. Full disclosure, I worked there for 15 years. So if I can't remember some of these numbers, there's really a problem.
She'll be a day center client.
Before you know it, that's for sure. All right, wonderful. All right, that's our wrap for this show. ALZ You Need to Know, answers to the questions that keep you up at night. And until next time, we'll see you then.
See you.
Bye-bye.
Bye-bye.